Hi there, this is Physio Paul. I'm back again with the fourth part of the electrocardiogram video series. In the previous video, the third part of the E.C.G series, we discussed about the definition of heart axis, right axis deviation in E.C.G and the medical conditions causing such phenomenon. But, in this continuation video we will discuss about the left axis deviation. So, let's begin then. The hexaxial reference system is a diagram that is used to determine the heart's electrical axis in the frontal plane. In electrocardiography, left axis deviation (LAD) is a condition wherein the mean electrical axis of ventricular contraction of the heart lies in a frontal plane direction between -30 degrees and -90 degrees. This is reflected by a QRS complex positive in lead I and negative in leads A, V, F and 2. There are several potential causes of LAD. Some of the causes include normal variation, thickened left ventricle, conduction defects, inferior wall myocardial infarction, pre-excitation syndromes, ventricular ectopic rhythms, congenital heart disease, high potassium levels, emphysema, mechanical shift, and pacemaker-generated rhythm or paced rhythm. Symptoms and treatment of left axis deviation depend on the underlying cause.
What is left axis deviation?
Cardiac axis in electrocardiography represents the sum of depolarization vectors generated by individual cardiac myocytes. To interpret the cardiac axis, one has to determine the relationship between the QRS axis and limb leads of the E.C.G. Usually, left ventricles makes up most of the heart muscles, so a normal cardiac axis is directed downward and slightly to the left. In a normal axis, QRS is between -30 degrees and +90 degrees. In contrast to that, left axis deviation (LAD) is defined as QRS axis between -30 degrees and -90 degrees, and right axis deviation is defined as QRS axis greater than +90 degrees, while extreme axis deviation occurs when QRS axis is between -90 degrees and 180 degrees.
Determining left axis deviation.
Determining the electrical axis can provide insight into underlying disease states and help steer the differential diagnosis. There are several methods to determining the E.C.G axis. The easiest method is the quadrant method, where one looks at lead I and lead AVF. First, examine the QRS complex in both leads I and AVF and determine if the QRS complex is positive height of R wave greater than S wave, equiphasic R wave equals S wave, or negative R wave less than S wave. If lead I is positive and lead AVF is negative, then this is a possible LAD. To determine a true LAD, examine QRS in lead 2. If the QRS complex is positive in lead 2, then this is a normal axis. On the other hand, if QRS complex is negative in lead 2, then this is a LAD. Another method of determining LAD is called the isoelectric lead, which allows for a more precise estimation of the QRS axis.
Causes.
There are several potential causes of LAD. These include normal variation, left ventricular hypertrophy, conduction defects, inferior wall myocardial infarction, pre-excitation syndromes, ventricular ectopic rhythms, congenital heart disease, hyperkalemia, emphysema, mechanical shift and pacemaker-generated rhythm or paced rhythm. Normal variation causing LAD is an age-related physiologic change. Conduction defects such as left bundle branch block or left anterior fascicular block can cause LAD on the E.C.G. Pre-excitation syndrome such as Wolff-Parkinson-White syndrome as well as congenital heart diseases such as atrial septal defect, endocardial cushion defects can also cause LAD on E.C.G. Mechanical shifts that cause LAD are expiration or raised diaphragm from pregnancy, ascites fluid accumulation in the abdomen, abdominal tumor, or enlarged liver or spleen.
Signs and symptoms.
Left axis deviation symptoms depend on the underlying cause. For example, if left ventricular hypertrophy (LVH) is the cause of LAD, symptoms can include shortness of breath, fatigue, chest pain especially with exercise, heart palpitations, dizziness, or fainting. If a conduction defect such as left bundle branch block is the cause of LAD, There may not be any symptoms unless the conduction defect is caused by heart failure, in which case there can be symptoms of heart failure such as shortness of breath or fatigue.
Treatment.
Left axis deviation treatment also involves treating the underlying cause. If left ventricular hypertrophy (LVH) is the cause of LAD, treatment depends on the underlying cause of the hypertrophy. If high blood pressure is the cause of LVH, then treatment is targeted at lowering blood pressure and preventing further enlargement of the left ventricle by using medications such as angiotensin-converting enzyme inhibitors (ACE inhibitors), angiotensin receptor blockers (ARBs), calcium channel blockers, diuretics, and beta blockers. If LVH is due to valvular issues such as aortic valve stenosis, surgical repair of the valve or replacement of the valve is required.